Welcome to RSM's CEO to CEO video series, Leading the Real Economy. I'm Joe Adams, Managing Partner and CEO of RSM US LLP. I'm meeting with fellow leaders, business leaders around their businesses and how they are guiding their companies through the coronavirus pandemic and the recovery beyond. Today, I'm joined by Aurelio Fernandez, President and CEO of Memorial Healthcare Systems, based in Hollywood, Florida. They operate 6 hospitals in South Florida. Thanks for joining me today, Aurelio.
Thank you, Joe, and thank you to RSM for taking the time for us CEOs to share our stories during these very, very unique and difficult times.
As you think back to March, when the pandemic really started to hit and you were faced with really trying to gear up and for what was going to happen, how did you really incorporate the various areas of safety, of ensuring that you had supplies and inventory, making sure that the patients were taken care of? What was that like as you tried to formulate your plans?
It was all new to us. The first positive COVID happened on February 26 in Washington State. The first one in Florida was March 1st, and the first one in our healthcare system was on March 7th. So that did not give us a lot of time for mobilizing what we felt was essential to contain the event. When we realized that this thing would spread more quickly than anybody had anticipated, we put together a multidisciplinary team with our chief medical officer, our chief intensivist, our chief nursing officer, our chief infection control physician, to set out guidelines to what is the frequency of tests that we need to do. So we were all learning as we go along. We did know that it was a respiratory illness and we needed to have capacity, and we know that we needed to isolate and have negative pressure rooms. And we needed to make sure that there was adequate supplies. Now, we were very fortunate because of our hurricane status here in South Florida. We did have adequate inventory supplies that would carry over. At the same time, when SARS happened a few years back, we had made a business decision to increase our inventory levels for PPEs, or personnel protective equipment. So we have not experienced a level of, from the market perspective, a level of deficiencies in the amount of PPE. So by meeting, and we met every day at 11 o'clock with the clinical team and at 1 o'clock with the supply team to monitor exactly what is going on, how much of the supply is being consumed, what is the burn rate, what are the trends as to positive COVIDs in our market. So we had enough data that we could not react, but anticipate what was happening. So we took a very proactive approach. We're very fortunate that here in our market, certain steps took place prior to some other states. You know, we closed the schools earlier, businesses. The governor had an executive order to close businesses. So by communicating on a daily basis, we were on a marathon. Every day, conferences, making sure we had adequate supplies, making sure the staff was protected. That was our main emphasis. You need to provide a safe environment to the staff. And the staff is all the clinicians, all the physicians, transporters, housekeepers. And we were very successful at it. We have had a very, very positive results in our infection rates when it comes to employees. It's like non-existent.
So Aurelio, continuing on, as Florida starts to reopen, what additional challenges do you face that maybe stand out above the rest?
Well, one of the things that we have here, we have a large number of nursing homes. And nursing homes do not have the resources, both economically and materially and personnel, to address the issues. And we were very vigilant as to what could happen if it is spread in these nursing homes and assisted living facilities. Because if you think about it, the population of the residents in these facilities are 65 years in age or older, and they're the most vulnerable. So we were very concerned. And one of the things that we did here in South Florida in collaboration with all the hospital systems, not just ours is to monitor the number of residents that were visiting our emergency rooms. So we were tracking every time one of the residents from a nursing home would present in the emergency room, we would keep track. And if we identified a hotspot, we would send our personnel, well, we will call first, say, you got a problem or whatever, but we would send our own personnel to do an assessment and evaluation. And in several occasions, in more than 3 occasions, we were able to loan them PPEs. We were able to send our cleaning staff to help them clean, educate the staff as to what to do and not to do. And we have been able to bring that under control, especially around our market. Each one of our hospitals, over a 5-mile radius, we have identified each one of our nursing homes so that we know what to track. And we have also suggested that same model to other healthcare systems here in South Florida.
So there's also a business side to this as well. And for you in running a hospital, what was that like as you had to continue to operate a business and worry about costs and liquidity? What sort of things did you have to react to be able to continue to operate in an effective way?
That's a good question, Joe. Now, we have a very strong, as Carlos Hernandez would tell you, we have a very strong balance sheet, which give us comfort. But at the same time, we need to be prudent as to our expenditures. We did cut a number of benefits that we had for not just senior management, all management personnel. We cut out all the bonuses for this year, all the contributions to the 403 plan that we would provide. Physicians were also included. We have about 300 physicians on the payroll. They were also subject to the same restrictions. We required all the staff to take 1 day a week off to reduce their personal leave bank. What we have seen is that I can tell you in April, our surgeries were off 72% from prior year. Our ER visits were off 57% from prior years. Our admissions were off 45% from prior years. So you're absolutely correct. The financial hit was significant. Now, the federal government did release some care money that would benefit the hospitals or the healthcare industry, but it's not enough to cover the deficits. We have been running at a loss over the last 3 months, and that has never happened in this organization. But we feel that the steps that were taken minimize the losses. For example, our supply costs were reduced significantly because you were not doing surgeries and you were not consuming it through admitting process. The other thing that came down was the use of our healthcare benefits. The staff was not accessing the emergency room or going to see physicians. So between those items, we were realizing savings of about $10 million a month.
Wow.
But even with $10 million a month, it wasn't enough to offset the reduction in net revenues of $30 million. So we have been, over the last 3 months, like I said earlier, we've been running at a deficit from operations. But we still have a very strong balance sheet. We have a very strong cash position that we don't feel would be necessary to deplete. The only supply that we had an issue with, what is called the N95 small. Apparently, there's more staff requiring N95 small than the regular ones. And everybody's in the same problem. It's not unique to us. So when you have a market-wide shortage of N95 smalls, everybody's, hustling to secure. So what happens? The price of these protective devices go up. Then you go from a 40-cent per unit to $3-4 per unit in the marketplace.
And I heard while all this was going on, of course, the governor contacted you to assist with setting up testing facilities in South Florida. How did that come about, and what did you have to do to prepare for that?
Joe, this was very interesting. On a Sunday afternoon, I get a call from the governor's office. I know the chief of staff very well, Shane Strum, and I get a call from the governor's office telling me, Aurelio, would you guys with Memorial be willing to partner with the National Guard and set up a drive-through testing site? And I said, sure, of course. We'll do anything we can to help. The governor has been very attentive to the needs of the healthcare industry in Florida. So he had a public announcement on Sunday, later on Sunday around 6 o'clock, stating that the first site is going to be here in Broward County. They selected a park We call it CB Smith Park. The National Guard came in on Tuesday. We started training the National Guard by Wednesday and Thursday. On, I believe it was Thursday or Friday, the governor came down and to visit the site and announced to the South Florida market that we were opening up a drive-thru. We worked in concert in partnership with the National Guard. There was about 130 some odd National Guards. They also sent contracted labor from all over the United States to work at the site. And we also added our own personnel, nurses and technicians, to make sure we got it through. One of the breakthroughs in this particular site was the automation of registration and scheduling. The original proposal was a paper system, and we just thought that that would be archaic. So our IT department and our business office personnel went out there, convinced the National Guard that this was the best way to go about this. And we rolled out a automated process that took the average cars at the beginning. At the beginning, you're still learning what you have to do and everything else. But we brought it down to less than a half hour from the time somebody presents to the time that they are out of the park in the car. They don't have to leave their automobiles. Now, they have to schedule it. We will not take anyone coming in without being scheduled. And that has also helped. And we verify that it's the right personnel, and the turnaround time on those results are quite impressive. It's less than 48 hours.
So your employees, of course, are on the front lines. How have they been involved in really helping with determining what the right process is and ensuring the safety of everyone involved?
Obviously, that's a very good question, because they're in the front lines. They're the ones that are telling us. We can provide guidelines, but they need to make sure that we adhere to those guidelines. And you don't go into a patient's room unless you're properly equipped. We checked each other's. The staff checks, make sure that all the protective equipment is correct, that the gloves are there. We have even set up a virtual process where each patient on a designated COVID unit, the bed has an iPad, and then the physicians and the nursing staff remotely are able to evaluate and have a conversation with the patient. And that accomplishes a couple of things. First, we're using technology to deliver healthcare. And second, it also reduces the amount of PPEs that is consumed, because with shortages in the marketplace, you want to preserve as much as possible. So if you go into the patient's room one time instead of 5 times, you start doing the math, and you can imagine the amount of savings that we incur. So it is very important that we listen to the frontline staff. We do continue to have, like I said, daily meetings with our clinical personnel, and recommendations are addressed at that committee meeting, and then it's disseminated throughout the organization to be consistent on what each one of the hospitals do.
So as you were gearing up again for all of this, and the focus on the pandemic and the virus itself, how have you had to adjust like what your employees did, and have you had to retrain individuals to really focus on the task at hand? Absolutely.
And here's some of the things that have come out of this whole pandemic situation, and that is the use of virtual consultations. Our physicians were redeployed, since patients were not going into the hospital or to their offices, to use virtual consults. And we have just taken that particular technology to its full potential. We have seen over 35,000 consults since April, the 1st of April, when we instituted this. So we redeploy physician assistants, we redeploy physicians into more of a virtual environment. We also redeployed nurses and other personnel. We created our own manufacturing of face masks. We had 30 individuals that were willing to start sewing and cutting and a material called polypropylene, which is the material used to sterilize instruments in the OR, and create our own manufacturing concern. And I can tell you, we've done over 12,000 of these masks for visitors, for others who might not have masks. We also did the face shield. We've done over 10,000 face shields. Even though we have it on inventory, We just don't know what's going to happen in the future. Folks who were working in the rehab unit are working in our warehouse. Usually they're very strong and they're very physical, so picking up boxes and so forth. So we have redeployed the personnel. And lastly, the working at home model. We have been able to shift people that used to come to the office every day, especially in the back office, registration, accounts receivable, scheduling, to work out of the house.
And speaking of messages, I've noticed that you have quite a bit of videos on your website, and you have been engaged in really communicating with the community. You know, what was your goal there in terms of the amount of communication that you've been providing? I think it's been very helpful.
Absolutely. As a matter of fact, I'm going to be videoed at 12:30 today. We need to keep the employees abreast of what's going on. It's a collective effort, and it's such an experience that everyone has gone through. So I use the videos on YouTube's and to communicate what's opening, what are some of the things that we're doing that are unique. For example, we have a prayer every week to recognize the number of positive COVID patients that are going home. We have had over 860 admissions with positive COVIDs. If one of those patients expires, one hospital will put a ribbon on a tree and there's a ceremony to it once a week. Another one put angels on the ceiling. So we have a mechanism. I was able to experience the process this week. We were filming at one of our hospitals, and a patient was being discharged, a positive COVID patient. And we played the Rocky theme over the loudspeaker, and then the staff lines up the hallway and everybody applauds. And that was quite an experience for me because I had not experienced it. So that is caught on video. We share that with the rest of the hospital systems. We also share the fact that we have been working with a food bank. And what is it that we do with the food bank to go out to those communities that are in need because they don't have jobs. I mean, we have a very high unemployment rate, folks out of work. And so we align ourselves with community leaders, and we share all these stories. We also share heroes, things that people have done that are unique. And so you have multiple mediums. You got nursing has a blog that they use to communicate the heroes. They use my blog for the staff, and then we do one for the community at large so they can see what Memorial Healthcare System is doing. And it has worked very effectively. I mean, the feedback has been extremely positive.
Yeah, no, it seems like you've done just a remarkable job in so many different ways, and really have made such a difference. When you think about everything that's happened over the last 3 months, and even before that, what are you most proud of in terms of where you're at today and what you've seen?
The fact that our employees are safe. We did not have the virus spread. We set up tents outside of each emergency department to screen everybody. Every employee is able to be tested for COVID. We did away with visiting hours. Anyone who comes into the hospital is tested. So maintaining and restricting any spread of the disease is extremely proud to me, because the employees come first. At the end of the day, if we have an employee base that gets sick, who's going to care for these patients? They're in the front lines. So we need to provide, and our board of commissioners gave me the authority to spend whatever dollars are necessary to have appropriate PPE inventory. So we never spared a dollar for the safety of the employees. I can tell you that competing hospitals are helping each other. That has never happened, not only just in Broward County, but in Miami-Dade and Palm Beach. We used to have calls every 3 days a week with the Secretary of the Agency for Healthcare Administration to give updates on how we can help each other. The fact that we were able to avoid the spread of the disease in nursing homes. I mean, there's so many positive things that have come out of this. I'm so proud of the way we responded. Think about just telemedicine. We were doing 200 consults a week, and we've done 35,000 since April 1st. That is huge. And it's going to change the landscape in healthcare. Healthcare is going to move more into the virtual arena than we anticipated. So a lot. I'm very proud, Joe, of the team, the Board of Commissioners for giving us the money, and what everybody has done to keep the community safe.
Thank you. And thank you again for joining me today and sharing your insights. It's an amazing story, amazing things that you've done. All of us at RSM wish you and all of your employees and people that work in the healthcare system and your patients all the best, and certainly be well. And for those of you joining us on the telecast, please, I hope that you enjoyed it as much as I did. On behalf of Aurelio Fernandez, I'm Joe Adams, and we'll catch you next time.